Hey everyone, this is Rick MacDermid here with Senior Solutions Group. I hope you're doing well. Thank you for watching this video. I had a conversation yesterday from a RN at a hospital here where I live, and she is getting ready to retire after about 37 years at the hospital. Part of her job is to determine whether a hospital visit will be classified under Part A as an inpatient visit or under Part B as an outpatient observation visit. In the Medicare and U book for 2019 on page 27 and 28, it talks about the difference between Part A visits and Part B visits. You could go to the hospital, and she told me this, more and more the trend is for Medicare to really facilitate Part B observation visits to the hospital, even if it's for a heart attack. It's very important to remember that under Medicare, for Part A inpatient care visits, there's a 3-day requirement to qualify for skilled nursing facility benefits. So if you're in the hospital only for observation, that doesn't count. You have to have 3 days as an inpatient, actually 3 nights as an inpatient, to qualify. If you don't meet that requirement, you're on the hook for that full skilled nursing facility, the cost of that care from day one. So it's very important to remember that you could be admitted as an outpatient instead of an inpatient under Medicare, and under Medicare you pay 20% of the Part B outpatient expense. So if you don't have a Medicare supplement plan, or you only have Part A and B of Medicare, it's important to know this could really affect you in a big way. So if you have any more questions, feel free to contact me at Senior Solutions Group. Thank you.